Due to the pandemic, the long border between the U.S. and Canada remains closed to non-essential travel. But essential does describe the work of a small army of Canadian healthcare workers. Every day they cross into the U.S. to care for American patients in Michigan hospitals. And during COVID, some got infected themselves. In Canada, there's been a pushback from people who fear these healthcare workers could bring the virus back home. But Adriana Diaz spoke with two nurses who say despite those challenges, they wouldn't have it any other way.
Detroit nurse Brent Gayle's commute typically starts at 6 a.m. and in another country.
I cross that international border every day. So when someone here says they were late because of traffic, I'm like, I came from another country.
He works at St. Mary Mercy Livonia Hospital in Metro Detroit.
How you doing, brother? Fine, yourself?
But lives across the Detroit River in Windsor, Canada.
We are on Riverside Drive in Windsor, Ontario, looking at Detroit.
At least 1,500 Canadians work in healthcare in Michigan, some drawn by more job opportunities.
Do your patients realize how many Canadian nurses there are working here in Detroit?
No, I don't think they do. But they tease and joke that, you know, I'll say something, it'll be a turn of phrase, and then, oh, you're Canadian. So you get that.
You say a boat or something like that?
Apparently I do.
This small army of Canadians have risked their lives, especially in the spring of 2020, when COVID raged in the U.S. and there were more daily COVID deaths in Michigan than in all of Canada.
It sucked. It was really bad. You'd see the wave coming, and you're like, okay, we survived it, and then that next wave was coming again before you could catch your breath.
I just remember thinking, like, what is going on? Like, we're running out of ventilators, like, everybody needs to be intubated. Yeah.
Canadian Lindsay Lafleur has been an ER nurse at Detroit's Henry Ford Hospital for nearly 5 years. She says last spring's surge is still vivid.
I just remember standing in the middle of the department and just looking around, like, dumbfounded and sad.
It must have been pretty overwhelming.
I cried a lot. Yeah.
Parker, say good morning. Morning, boo-boo.
At COVID's worst in Detroit, she had a newborn at home in Canada and considered walking away from nursing.
How nervous were you about your baby?
I was really nervous. She was really young, so we had her sleeping in a pack and play in our room, and I was sleeping in her room in a tent because I wanted to, like, conceal myself somehow.
So why do you do it? Why do you continue to come over the international border to work here in Detroit with COVID patients?
I love working here. I love Detroit. I love the hospital that I work for. I love the people that I work with.
You like Detroiters?
I like Detroiters, yeah.
It's not a border, it's just a line we cross, and we're the same people, you know? And I just think it would have been horribly cowardly to abandon my American cousins.
But back home in Canada, there was some resistance to their cross-border work.
There was sort of a stigma attached to it.
A stigma?
A little bit. You know, you're carrying the disease back and forth. There was a call in our local paper to have us, you know, stop being allowed to go back and forth across the border.
I was feeling the stress from the community. People were like, you know, we thank you for all that you do, but at the same time, like, don't come near me.
Both did contract COVID. Gayle, when a patient's intubation tube came loose, Lafleur thinks she may have gotten it in Windsor. Luckily, her daughter did not. They recovered and remain committed as ever.
Such a handsome nurse.
Oh, you're awesome. Stop it, you're making me blush.
Still treating their patients with a smile.
There's this perception of Canadians, you know, the Canadian nice stereotype.
Yeah.
Is that real, and does that help you at work?
I think it's more politeness than nice, and it does help. And we have patients come back all the time. Oh, I'm looking for the big bald Canadian.
Here, the two sides of the river are one community, and the nurses protect their own.
Like, this is our big deal, you know, this is our burning building. This is what we run to and what we've been trained for, like our moment to shine.
For CBS This Morning Saturday, Adriana Diaz, Detroit.
I grew up just a few miles from the Canadian border, so I know how close that relationship is and how frustrating it's been for so many that the border has been closed for so long. But the work that they're doing there is just remarkable.
I love how he said it's just a line we cross. They're our cousins.
That's right.
Yeah, and you see the personal sacrifice. You're reminded of these healthcare workers' personal sacrifices, even as they care for others.
Still doing it today.
Yeah.
Still doing it
day in and day out. Well, thank you so much, Adriana.